In this video I will discuss cat scratch disease. As the name indicates, it spreads from the cat. The causative organism is Bartonella henselae that causes the infection and transmitted via scratch or bite or lick from the infected cats. Typical presentation: there is history of recent cat exposure, for example cat scratch within 1 to 3 weeks, that is the incubation period for cat scratch disease. Primary lesion: here you can see a primary lesion. It is a small pustule at the scratch site. So primary lesion is a small papule or pustule at the scratch site. While there is regional lymphadenopathy, it depends on the region, which region is involved. And for example, if the limb is involved, upper limb, then it is axillary. If it is on the face, then it is cervical. And if it is on the limb, it can be epitrochlear. It depends on the site. Nodes may become fluctuant or suppurative, that is, they may contain pus. Systemic symptoms may be mild or absent. These include fever, fatigue and malaise. As with any other fever, headache and anorexia are also observed. Then we have atypical or complicated presentations, mostly seen in those patients who are immunocompromised. There is Perinard oculoglandular syndrome. It means conjunctivitis, preauricular lymphadenopathy. There is conjunctivitis and preauricular lymphadenopathy, also known as Perinard oculoglandular syndrome. Oculoglandular, oculo conjunctivitis and glandular lymph nodes. Neuroretinitis, there is vision loss, and encephalopathy and seizures. Sometimes there is hepatosplenic granulomas. Granulomas form in the liver and spleen. Course: it is usually a self-limiting condition in 2 to 4 months, and in immunocompromised patients there is risk of bacillary angiomatosis. There is formation of papules that bleed. In case of bacillary angiomatosis. Diagnosis: there is mostly clinical diagnosis because of history of cat exposure and papule at scratch site and renal tender lymphadenopathy, as I have shown you here. There is lymphadenopathy, renal lymphadenopathy, and here is primary lesion. But you can also go to labs like serology, IgG for Bartonella henselae. It is very specific but less sensitive. You can also go for PCR, and you can also go for lymph node biopsy. Ultrasound should be done if lymph node suppuration is suspected. Lymph node biopsy is done only if malignancy or TB is suspected. It is rarely needed. So the labs which should be done are: first one is serology, second one is PCR, third one is ultrasound, and fourth one is lymph node biopsy. Management: in case of mild or typical cases, if the patient is immunocompetent, it is usually a self-limiting condition and no treatment is usually required. Only analgesics and warm compresses for pain. But if antibiotic is needed, then azithromycin is given as first line antibiotic. Azithromycin is given for 5 days. 500 mg on day 1 and then 250 mg daily for next 4 days. If there is complication or the patient is immunocompromised, then azithromycin or doxycycline along with rifampicin. You should give azithromycin or doxycycline along with rifampicin for 2 to 3 weeks. So this is all about cat scratch disease.